You've probably been hearing a ton about this new generation of weight management medications. So today, we're going to break it all down for you. A clear, no-nonsense guide to what they are, how they work, and what you really need to know.
So, are these drugs a weight loss miracle or just a risky trend? Let's cut through all the hype and get straight to the facts. What are these medications, who are they for, and how do they actually do what they do?
We're going to walk through the entire journey, from the science behind that first prescription all the way to the realities of long-term success.
Okay, let's dive right in by understanding the basic science. What are we actually talking about here?
So the official name for this class of medication is a GLP-1 agonist. Now the key thing to get is that these aren't stimulants or old-school diet pills. They work by copying a hormone your body already makes naturally to help manage your hunger and blood sugar.
So how does copying a hormone actually lead to weight loss? Well, it's kind of a three-part punch. First, it sends a signal to your brain that says, hey, we're full. Second, it slows down how quickly your stomach empties, which keeps you feeling physically full for way longer. And third, you put those two together and it just leads to a lower overall appetite, so you naturally eat fewer calories without feeling like you're starving.
You've definitely heard the names Ozempic and Wegovy. Now here's something that trips a lot of people up. They are the exact same core drug. It's called semaglutide. The only real difference is how they're branded and approved. Ozempic is primarily for type 2 diabetes, while Wegovy is specifically dosed and approved for chronic weight management.
So, what about the results? What can people realistically expect? Well, in clinical practice, a lot of patients see an average body weight loss of around 10 to 15% over a year. But, and this is a huge but, that's achieved when the medication is paired with diet and exercise. Results are always going to vary from person to person.
All right, so you get the basics. How do you actually get started? Let's look at the practical side of things. Who's eligible and what those first steps look like.
In the United States, the medical guidelines are pretty specific. A clinician is generally looking for a BMI of 30 or higher, or a BMI of 27 or higher if you also have a weight-related health condition, like high blood pressure, sleep apnea, or prediabetes.
And of course, safety is priority number one. Your doctor is going to screen you for some really key conditions where these meds are just not recommended. This is a big one, a personal or family history of specific rare thyroid cancers. Also, if you're pregnant or trying to become pregnant, or have a history of pancreatitis or severe GI issues.
Now, there's a golden rule for starting these medications, and it's absolutely crucial. Start low, go slow. The dose is increased really gradually, usually every 4 weeks. This whole process is designed to let your body get used to it, and really importantly, to keep those side effects to a minimum. Okay, that brings us to the core of it all. What does it actually feel like to be on this medication? Let's get into the reality of that first year, week by week and month by month.
You know, it's so important to realize this journey is not a straight line down. That first month, you're on a low dose. It's really a learning phase. Then around months 3 to 6 is often when the appetite control really kicks in and you see steady progress. And later on, hitting plateaus is completely normal. It's not a sign of failure, it's just a sign that it's time to dial in your other habits.
All right, let's talk about the not-so-fun part, side effects. The truth is, most people do experience some of these, especially right after a dose increase. Nausea, a really intense feeling of fullness, and some digestive stuff are super common. The good news is, for most people, they are temporary and they do get better over time.
Okay, this is critical. You have to know the difference between a normal annoyance and a red flag. Mild nausea that comes and goes, that's pretty common. But severe, persistent stomach pain, that's a red flag, and you need to call your doctor. Knowing this difference is key to using the medication safely.
And that leads us to what might be the single most important takeaway here. This medication is an incredible tool. It's powerful, but it is not magic. It helps you execute your health plan by controlling your appetite, but the plan itself, the nutrition, the movement, the sleep, that still comes down to your choices. And those choices are what decide the finish line.
Now, let's get real about the obstacles. For a lot of people, the biggest challenges aren't the side effects. They're the cost, the insurance headaches, and just being able to get access to the medication in the first place.
Navigating the stuff requires a strategy. Think of it as your own personal playbook. Step 1, check your insurance plan specifically for anti-obesity medication coverage. Then work with your doctor to get all the paperwork together. Look into savings programs from the manufacturer. You just have to be proactive to find a plan that's actually sustainable for you financially.
And you just got to know, the landscape for supply, for cost, for insurance coverage, it's a moving target. It is constantly changing. So being persistent, staying organized, and planning ahead can make a world of difference.
Okay, so let's zoom out and talk about the long game. Because weight management is a chronic thing, the approach has to be sustainable for life, whether that means staying on medication or not.
And this is it, right? This is the million-dollar question that everybody asks. What happens if you stop taking the medication? Well, the biological effects of the drug wear off. And for most people, that means those appetite signals are going to return to where they were before.
This is exactly why having a maintenance playbook isn't just a nice idea. It's non-negotiable. The goal is to build durable habits that can take over the job the medication was doing. That means things like keeping your protein intake high to stay full, sticking with resistance training to keep your muscle, and having a system in place, like a guardrail weight, that tells you when it's time to refocus.
And this quote just hits the nail on the head. Long-term success isn't about having endless motivation. Nobody has that. It's about building simple, solid routines for how you eat and how you move that you can fall back on even when life gets crazy.
So, after all of this, is this tool the right fit for your health journey? Well, ultimately, that's a really personal question. And the best answer is going to come from an informed, honest conversation with your healthcare team about your health, your goals, and what you're ready for.